Ladies and gentlemen, welcome to our live session on hair wellness. I'm Deepti Diwan, your host for today, and today we shall be talking about hair care in winter. Well, our hair is our crowning glory. It symbolizes our personality and tells people so much about us. Strong and healthy hair can indeed boost our confidence. It's very important to take care of our hair and keep it looking gorgeous every single day in all seasons. This winter, let's care about our hair from the roots to the ends. And today we have the opportunity to engage in a conversation with Dr. Deepak Kotkar, consultant dermatologist, private practitioner at Nashik for the last 23 years. Dr. Kotkar is the current president of the Nashik chapter and previous lecturer at GMC Dhule. He's also the organizing secretary of Cuticon Nashik 2015. And today he has been kind enough to take out his valuable time and join us here to help us take good care of our hair in this season. Welcome, Dr. Kotkar.
Thank you very much.
Doctor, our viewers are looking forward today. So, आज हम बात करेंगे हेयर केयर के बारे में. So, डॉक्टर सबसे ज़्यादा जो कॉमन कंडीशन है हेयर के बारे में इन winter के season में वो है dandruff. So, doctor, please tell us what exactly is dandruff?
Yes. All of us, or maybe 70-80% of the population, might be suffering from this condition called as dandruff, जिसमें कि बालों में स्किन के स्केल्स निकलते हैं, छुरियां निकलती हैं, and it gives lot of discomfort to the patient. It gives lot of pruritus to the patient. So ये क्या होता है कि इसमें से स्किन के जो स्केल्स हैं वो निकलने लगते हैं और ये ज्यादा करके विंटर के सीजन में ज्यादा हो जाता है.
जी हाँ. सो उससे डॉक्टर लोगों को काफी एम्बैरेसमेंट होती है, लेकिन जैसे कि आपने कहा कि डैंड्रफ एंड विंटर के में एक कनेक्शन है, तो वो क्या एग्जैक्ट कनेक्शन है? व्हाट इज द कनेक्शन बिटवीन विंटर सीजन एंड डैंड्रफ?
उससे पहले मैं ये बताना चाहूंगा कि डैंड्रफ इज we can say that it is kind of a universal thing. It can affect any age group, but particularly if you see that it affects mainly the age group between say 15 के ऊपर 15 के ऊपर चले जाएंगे तो around 50 age, so that is the common age wherein we get dandruff. So उसमें severity रहती है कि young persons are affected more with dandruff, and the severity is also more. There are various reasons for this dandruff because of the sebum which has been produced in our body, especially in the sebum producing areas on the scalp or on the face or on the chest. तो वहाँ पे ये डैंड्रफ का जो प्रमाण है वो दिखाई देता है. बालों में ये ज्यादा करके दिखाई देता है, सर के बालों में, और अगर उसकी ज्यादा हो जाता है तो हम उसे सिबोरिक डर्मेटाइटिस ऐसे बोलते हैं. तो वो फिर आंखों के ऊपर या आईलिड्स पे, आईलैशेस पे, फिर चेस्ट पे भी आ सकते हैं, कभी कभी मुस्टैच में भी आ जाते हैं. तो ये सीवियर टाइप ऑफ डैंड्रफ रहता है. और विंटर में ये ज्यादा इसलिए हो जाता है कि विंटर में स्किन काफी ड्राई हो जाती है, जिसकी वजह से ये स्केल्स निकलना ज्यादा, द स्केल्स आर मोर प्रोड्यूस्ड और दे आर मोर जनरेटेड because the generation time of the scales has reduced during this winter season. So that's why we get more number of people affected with dandruff during winter season.
Okay. So it's mainly because of the dry weather, the dryness
Yes.
in your skin.
There are some minor factors also, like there are people who are going out in the sun for longer time. Exposure to excessive sunlight is another factor. और डर्ट या डस्ट में अगर जो काम करते हैं या उनका ज्यादा संबंध आता है, उनको ट्रैवलिंग करना पड़ता है. देयर आर मेनी पीपल हु आर ट्रैवलिंग 30-40 किलोमीटर्स अ डे ऑन अ टू व्हीलर, तो दे गेट सीवियरली अफेक्टेड बिकॉज ऑफ दिस डैंड्रफ. Another reason could be the various uses of cosmetic products, frequent changing of shampoos. So that can also add to the severity or aggravation of dandruff.
Yeah. So, doctor, these are some of the factors that you mentioned. These are probably the external factors that are the reason for causing dandruff.
Yeah.
So, controlling these, you say, would help probably in controlling dandruff?
Yeah. These are the external factors. But see, our body or the scalp hair, they are studded with some microorganisms that is known as the Malassezia furfur. So ये सब में थोड़े बहुत प्रमाण में होते ही हैं. So when the organisms they grow in big number, so then they cause this dandruff, or it is a kind of a fungal infection, or it is a kind of fungi which causes this dandruff. So that's why it is known as Malassezia furfur. तो ये dandruff उसकी वजह से ज्यादा होता है.
ओके तो डॉक्टर आपने डैंड्रफ और एक टर्म सेबोरिक डर्मेटाइटिस, तो इन इसके बारे में थोड़ा और ज्यादा आप एलैबोरेट करेंगे कि हाउ डज अ पर्सन कम टू नो कि उनको डैंड्रफ है या समथिंग मोर सिवियर उनको सेबोरिक डर्मेटाइटिस है, हाउ विल दे कम टू नो?
जैसे मैंने बताया कि डैंड्रफ में क्या होता है कि मेनली ऑलमोस्ट इन ऑल द पेशेंट स्कैल्प इज इन्वॉल्व. तो और वो जो स्केल्स निकलते हैं उसकी जो खपलियां निकलती हैं वो व्हाइट कलर की होती है और वो इजीली निकल जाती है. बट ये जो सिबोरिक डर्मेटाइटिस होता है तो दैट कैन अफेक्ट एनी हेरी एरिया. तो जब वो अदर हेरी एरियाज में जाता है और उसका प्रमाण भी ज्यादा होता है उसमें डैंड्रफ के, तो उसको हम सिबोरिक डर्मेटाइटिस बोलते हैं. जैसे कि मैंने बताया कि स्कैल्प के हेयर्स में, आईलिड्स में, आईलैशेस में, मुस्टैच में, या फिर आर्मपिट्स में, या चेस्ट का जो सेंटर का पोर्शन होता है वहां पे हेयर्स होते हैं स्पेशली इन मेल्स. तो वहां पे ऐसे लाल एंड द मोस्ट इंपॉर्टेंट थिंग टू डिस्टिंग्विश बिटवीन अ डैंड्रफ एंड अ सिबोरिक डर्मेटाइटिस इज अ रेडनेस. तो ये रेडनेस जो है ये सिबोरिक डर्मेटाइटिस में ज्यादा हो जाता है और उसकी जो स्केल्स रहते हैं वो थिक रहते हैं, वो चिपक जाते हैं वहां पे, एंड समटाइम्स इट इज डिफिकल्ट टू रिमूव दोज स्केल्स आल्सो. फिर क्या होता है कि ये जो स्केल्स है वो नीचे तक आके फिर नेक पे आ जाते हैं. तो दैट इज अ डिस्टिंग्विशिंग फीचर बिटवीन डैंड्रफ एंड सीबोरिक डर्मेटाइटिस. और उसमें स्केलिंग ज्यादा होता है, खुजली भी ज्यादा आती है. प्रोराइटिस इज आल्सो मोर इन सीबोरिक डर्मेटाइटिस एज कंपेयर्ड टू डैंड्रफ.
ओके सो डॉक्टर क्या ये कहना सही होगा कि सेबोरिक डर्मेटाइटिस डैंड्रफ का एक एडवांस्ड एग्रीवेटेड वर्जन है, ज्यादा स्ट्रॉन्ग वर्जन है?
Definitely, definitely. It is a definite aggravated or severe type of dandruff, you can call in a simple language. It is a kind of a different entity to us altogether.
ओके थैंक यू डॉक्टर. एंड जैसा कि आपने बताया एक्सटर्नल फैक्टर्स जो हैं, उसमें आप कुछ और एलैबोरेट कर सकते हैं मोर थिंग्स दैट पीपल नीड टू बी केयरफुल ऑफ, जैसे कि हेलमेट्स हैं, यू नो लॉट ऑफ पीपल वेयर हेलमेट्स, और यू
Yes,
नो
yes.
फ्रीक्वेंट कोम्बिंग करते हैं जो बार बार अपने बाल बनाते हैं, क्या इन लोगों को भी ज्यादा चांसेस होते हैं डैंड्रफ होने के?
Definitely frequent because of the excessive, or what we can say, not excessive, but the use of helmet for longer time, for the complete day, or frequent combing of the hair. So that adds to the aggravation of dandruff. Sweat वहां पे collect हो जाता है and then it aggravates the dandruff in these people. सेकेंडली कई लोगों को बालों में तेल लगाने का बहुत शौक होता है और वो बार बार दे कीप ऑन चेंजिंग द ऑयल व्हिच दे आर अप्लाइंग टू द हेयर. टू टेल वेरी साइंटिफिकली, oil is as such not important for growth, or for growth of the hair, or for new generation of hair. तो ऑयल लगाने से ऐसे कुछ बिल्कुल होने वाला नहीं है कि आपके बाल झड़ना कम हो जाएंगे या बंद हो जाएंगे या नए बाल आएंगे या सफेद नहीं होंगे. तो ऑयल की कोई जरूरत नहीं रहती है. और ऑयल से क्या होता है कि ये फंगस जो है वो ग्रो ज्यादा होता है और उसके स्केल्स भी ज्यादा बनते हैं और ऑयल की वजह से वो स्केल्स वहां पे चिपक भी जाते हैं. तो इट एड्स और एग्रेवेट्स द डैंड्रफ, सिवियरिटी ऑफ डैंड्रफ. तो माय एडवाइस टू all of the people would be to not to use oil to your hair.
Okay. So, in all this, I think hygiene is a very important factor, mainly, right? Looking after your scalp.
Yes. Yes.
Okay.
So for daily washing of the hair is very important. And if you are having dandruff, or even if you do not have a dandruff, you can use a medicated low pH quality or a milder shampoo, which will not cause dandruff, or which will prevent from dandruff being happening, which should have any antifungal as a constituent.
Sure. Doctor, could you please elaborate on the etiology of dandruff? What exactly is the cause of dandruff?
या जैसे मैंने बताया कि ये एक तरीके का फंगस होता है और उसमें एक बैक्टीरिया भी होता है जिसको हम पिटारास्पोरम एक्ने ऐसे बोलते हैं। तो ये दो तरीके के, और ये मेलासिजिया फरफर, ये फंगस होता है और ये दूसरा बैक्टीरिया होता है। तो दीज आर द टू कंट्रीब्यूटिंग फैक्टर्स फॉर द फॉर्मेशन ऑफ डैंड्रफ ओवर द स्कैल्प। तो ये क्या करते हैं कि वहां पे जो सीबम तैयार होता है उसमें से वो फैटी एसिड को चूस लेते हैं, और उसकी वजह से फिर वहां पे डैंड्रफ या वो स्केल्स बनना शुरू हो जाते हैं।
ओके, सो आपने फंगस का
तो
नाम बताया मैलिसीजिया,
जिनको स्वेटिंग ज्यादा
दैट इज
जिनको स्वेटिंग ज्यादा होती है, या जिनका वजन ज्यादा है, जिनको थोड़ा सा डायबिटिक है, या जिनको हेवी एक्सर्शन करने का जॉब है, तो दे आर लाइकली टू गेट अफेक्टेड मोर विद दिस मेलासिजिया फरफर, दिस काइंड ऑफ अ फंगस।
ओके। ओके, सो ऐसे लोगों को हाइजीन का ज्यादा ध्यान रखना
Yes,
पड़ेगा। They have
definitely,
to be,
yeah.
to make sure. Okay. Thank you, doctor. And doctor, a lot of people who suffer from dandruff are always complaining about hair loss. So, is there a connection between the two?
Yes, definitely. If the dandruff is there for longer duration, of the person is suffering from dandruff for longer duration, usually the normal range of daily hair loss is between 50 to 100. So in these people it goes up to 150 to 100 तक। जो इनको डैंड्रफ ज्यादा होता है, या जो ज्यादा दिनों से परेशान हो जाते हैं, या जो ट्रीटमेंट नहीं करते हैं, तो उनका डेफिनेटली देयर इज अ चांस कि वो हेयर लॉस ज्यादा हो जाता है।
Okay. And doctor, lastly, what is the treatment for dandruff? What are the different options? जब आपके पास कोई patient आ रहे हैं, what are the things that you recommend them?
Yeah. See, there are 2-3 types of treatment modalities would be available for this type of dandruff or seborrheic dermatitis. जैसे we have discussed that seborrheic dermatitis is a severe form of dandruff. So they should use shampoos with the advice of the dermatologist. And usually the shampoos which we recommend are containing some antifungal, or there is some medicine called as coal tar or salicylic acid. So salicylic acid जो होता है, तो it helps in removing the scales. So that is very important. So whenever a person is having severe or moderate type of dandruff, so that salicylic acid helps in removing those scales. So they should use a shampoo with salicylic acid, or an antifungal with salicylic acid. Frequent
And
washing
doctor, how
of the
often should
hair.
they use these?
Yeah, so these shampoos, depending on the severity, we advise them to wash the hair daily. And with these kind of shampoos, they should wash it alternately. Even if they find that alternately after doing the shampoo, they get immediately the next day, so they can wash it daily also with these shampoos.
Okay.
Yeah,
And
and
doctor, but a lot of people are a little worried about using these shampoos because उन्हें लगता है कि शायद ये ज़्यादा strong होते हैं. So ऐसा कुछ है कि these shampoos
yeah.
will harm the hair or one should use it very carefully?
Not very much. Only in those people who have to use it for very frequently. Once the dandruff has been settled, or once the dandruff has been cured, they can take preventive measures of not aggravating the dandruff, so that the frequency of using the shampoo can come down from thrice in a week to twice in a week. So like that they can manipulate, or they can adjust accordingly. जब dandruff की severity है, तो then they can do the shampooing accordingly. But this is a myth, or this is not a fact, that these shampoos or these medicated shampoos or these antifungal shampoos will cause hair loss, or it will lose the texture of the hair. ऐसे बहुत सारे लोगों के मन में गलत फहमियां होती हैं, तो that is not correct.
On the contrary, I think they will keep the hair clean. So clean
Yes,
hair
definitely.
means better.
Yeah, once the hairs are clean, once they are without dandruff, then very little efforts are needed to keep them hygienic.
Right. Thank you, doctor. And doctor, is dandruff contagious? And if a person has dandruff, then what are the precautions that family members or people around that person should take?
Dandruff as such is not contagious, so as such, no need for any extra precautions for the family to take care of. But the other members also should try and see keep their hairs healthy and without dandruff.
Okay.
So it is not a contagious disorder or a contagious disease.
Sure. And would you recommend that they use different combs and different hair products, hair towels, etc.?
There are two things, not necessarily. First is my answer that it's not necessary, and nowadays everybody is using a different towel or different comb for the so that is probably not a need to tell the family have these things.
Right. And doctor, like we said, teenagers, because of the hormonal changes in the body, they generally tend to suffer a lot more from dandruff and acne and all these issues. So,
Yes, yes.
any particular set of, advice or any instructions that you would like to give them, or any tips that you would like to share with them in particular?
Yeah. See, another important association of these dandruff is with the acne, which the young population suffers from the age of 15 to say 25 or maybe up to 20, 30. So this is the population which is likely to suffer acne, and almost in all these patients they are having acne. Sorry, they are having dandruff also. So for controlling acne or for not aggravating the acne, the treatment of dandruff is also very important. So whenever we have a patient of acne, we try and see whether he is also having dandruff and treat the dandruff accordingly.
Okay. And doctor, you mentioned that oiling is not really essential for dandruff, especially, and it, on the contrary, it may spoil the hair more and probably increase the dandruff. Doctor,
Yes,
what is your
definitely.
take on conditioning? When we shampoo the hair, is it important to condition? And if a person has dandruff, should they condition their hair or not?
Yeah, they can condition the hairs after shampooing.
Okay, thank you, doctor. And
Yeah.
any particular diet that you would recommend for dandruff that could help perhaps people who are suffering from dandruff?
A healthy diet with rich proteins. Milk is very important for the growth of hair. So milk has to be taken daily, and green vegetables, fruits. These are the essentials for growth of hair.
Okay,
No diet restriction as such is very important.
okay. And any particular vitamins or minerals, any supplements that we could take or you could recommend for curing dandruff?
No, as such, for dandruff, diet doesn't have any role to play. But for the growth of the hair, definitely we'll advise to go for vitamin B12 or non-vegetarian food. So that will help in the growth of the hair. So once the hair growth is proper, once the hairs are growing properly, there are likely chances of less dandruff.
Okay, that's informative, doctor, because a lot of people just think that B12 is just because just as a supplement, but we did not know that it also helps in hair growth.
Yes, definitely, definitely. Calcium is also another important nutrient which has to be supplemented. So,
Okay.
depending on the patient's diet or his daily habits, we can advise him extra supplements of calcium.
Calcium and vitamin B12 is that.
Yes.
Doctor, also a lot of people visit salons, and that is a potential place where people could contract, dandruff or any infections of the scalp. So, would you recommend them to be careful or to carry their own, probably, scissors or combs at salons?
Yes, yeah. We cannot exactly say that they can contract these fungal infection from there, but definitely the cosmetic treatments to the hair affect the hair growth. Sometimes people land up in different problems with the hair growth. The hair get tangled, and then it becomes difficult with any kind of shampoo or with any kind of treatment. That original look or original condition of the hair is not achieved very soon after some disastrous cosmetic treatments. So I advise our patients to do very milder forms of treatment to the hairs.
Okay, sure. Thank you, doctor. And doctor, does exercise play any role to control dandruff?
Yes, definitely keeping your body healthy will keep all the uh, parts of your body healthy. So hair is a part of your body. So doing exercise daily and taking a nutritious diet will definitely help in keeping the hairs healthy and thereby preventing dandruff.
Okay. Thank you, doctor. And doctor, is there any time limit that we should keep the shampoo on the hair for them to be effective? As these are medicated shampoos,
Yeah, they can be kept for
what is
about
generally
2 to 3 minutes.
pro-
Make a lather, keep it for 2 to 3 minutes, and then wash it with water.
okay.
Yeah,
So we should make a good lather, keep it for 2-3 minutes, and then wash
yeah,
it off.
keep it for 2 to 3 minutes. Yes.
Okay. And doctor, one of our viewers has asked, does diet play an important role during dandruff?
Yeah, as I said earlier, diet definitely has a role in maintaining the hair properly. So once the hairs are proper, dandruff will be less.
Okay. So any particular foods that they should avoid or anything that they should be consuming more of?
More of nutritious food and less of oily substances. The
Oily
only
food.
thing which we can ask them to avoid.
Okay. So it's best to avoid oily food during these times. Okay. Doctor, how about home remedies? Do we have any home remedies like people say, applying curd on the hair to cure dandruff? So would you recommend using any of these home remedies?
It's a debatable topic, but some people they get good results with these home remedies which have been there since generations of our older generation. But sometimes it causes side effects also, and sometimes it gives an rise to allergic dermatitis also. So better to avoid such remedies.
Okay, sure. Let's see if we have any more questions from the audience. Doctor, would any hair mask help in curing dandruff? We see a lot of hair masks available in the market and also homemade hair masks. So would they be suggested by you to cure dandruff?
If they are used properly and if they are not quite tight fitting, then they should not cause dandruff.
Okay, sure. And doctor, like you said, seborrheic dermatitis is a more aggravated form of dandruff. So,
Yeah.
if a person discovers these things, like you said, inflammation of the scalp, etc., then they should immediately go to a doctor, right? Because it could get more
Yes,
serious and
definitely.
cause
Because
them more
what can
itchiness,
happen
and the
what can
infection could
happen
perhaps
with
spread.
yes, yes, excess kind of seborrheic dermatitis because of scratching or because of the thick scales. That area may get secondarily infected with the bacteria, and then it may cause severe kind of folliculitis or skin infection over there. So it is better to avoid taking other treatments, and taking a good advice from a dermatologist is very essential in seborrheic dermatitis.
Okay, sure. Thank you, doctor. And doctor, a lot of people go for hair dyeing. So, would you suggest hair dyeing to who has dandruff, or generally does hair dyeing cause dandruff?
Hair dyeing does cause dandruff, but that sometimes is temporarily. And secondly, one advice for the people who want to dye their hair is to use the same brand any time. They should not keep on changing the brand, or they should not try different brands every time.
Okay,
Because it has been seen that if a person is found to have suitable for a particular chemical, then he should use that only. Should not try another one.
okay, sure. So once you have discovered what suits you, then you should stick to that and use that brand.
Yes, yes, yes.
Thank you, doctor. And can dandruff spread among family members?
No, there are no chances of this being a non-contagious disease. So the chances are not there that dandruff from one person will go to the other person.
Okay. And they should still avoid using the same towel and any common things like helmets or
Yes. It's better.
things like that. Okay, sure. Well, thank you so much, doctor, for your time. It was indeed very informative.
Thank you
And
very
I'm
much.
sure that our viewers have found all the answers that they were looking for. And they have got all the tips from you and great insights on looking after their hair this winter. So thank you once again for your time, doctor. It
Thank
was a
you.
delight for us to have you here. Thank you so much. And ladies and gentlemen, this is your host, Deepti Diwan, signing off. Until next time, where we discuss once again how you can take care of your hair this winter.